हो, जहाँ ज्ञान स्वतंत्र हो, जहाँ ज्ञान स्वतंत्र हो, जहाँ संसार संकीर्ण घरेलू दीवारों से टुकड़ों में ना तो तोड़ा गया हो, जहाँ संसार संकीर्ण घरेलू दीवारों से टुकड़ों में ना तोड़ा गया हो, जहाँ विचार सच्चाई की गहराई में उपस्थित हो, जहाँ विचार सच्चाई की गहराई में उपस्थित हो, जहाँ अथक प्रयास अपनी बाहें पूर्णता की ओर बढ़ते हो, जहाँ अथक प्रयास अपनी बाहें पूर्णता की ओर बढ़ते हो, जहाँ विवेक की निर्मल धारा अंधविश्वासों के मरुथल की नकारात्मक रेत में ना खो गई हो, जहाँ विवेक की निर्मल धारा अंधविश्वासों के मरुथल की नकारात्मक रेत में ना खो गई हो, जहाँ मन आपसे प्रेरित होकर निरंतर प्रगतिशील विचारों और कर्मठता की ओर बढ़ता हो, जहाँ मन आपसे निरंतर प्रेरित होकर निरंतर प्रगतिशील विचारों और कर्मठता की ओर बढ़ता हो, उस स्वतंत्रता के स्वर्ग में, उस स्वतंत्र के स्वर्ग में हे परमपिता मेरे देश को जागृत कर दे, मेरे देश को जागृत कर दे।
Thank you, Tarika ji.
Welcome. Welcome.
So before we start the session by Dr. Nipah Seth, just I want to introduce. Hi, let us. Baljeet ji, can you unmute, please? Yeah.
I am unmute.
Actually, co-host बनाया हुआ है, किसको co-host बनाया हुआ आपने?
मैंने सबको बना दिया है.
सबको बना दिया?
हाँ जी.
Okay.
Okay.
So.
Would you like me to mute everybody?
हाँ.
अच्छा जी. Okay. अब आप उसके बाद अपने आप को खोल लीजिए. अनम्यूट कर लीजिए अपने आप को.
Yes. So Dr. Nipah Seth is a dentist by profession. She has been practicing for 22 years and is well reputed in the field of dentistry. She currently practices in Saratoga, California. She is an active investor in early stage startups working on breakthrough technologies in medical, dental, and wellness fields. She was the co-founder and artistic director of the popular dance group called Zingaris. She served on the board of ICC and currently serves as a board member of Stanford Care, El Camino Hospital Foundation and ICC Wellness, and as founding board member of ICC Palo Alto. She is passionate about education, health tech, and community involvement. So I request Dr. Nipah Seth. I'm very sorry I pronounced, I wrote somewhere not Seth, is as Seth, S-E-T-H.
Seth.
It is heavy.
It's okay.
It is heavy. So
Common mistake.
I'm sorry for that.
No problem.
Please take over.
Yeah, no problem. Thank you. So I'm going to share my screen so you can see the presentation.
Yes, I already.
Okay, so so today's presentation is about the very relevant topic about the COVID-19 vaccine. If I'm going too fast, please feel free to stop me. It's an uppermost question in everybody's minds. Should I take it? Is it safe? What should I watch out for? Can I take it later, etc., etc. So I'd like to address some of those issues. So first, before we delve into the vaccine, let's talk about the disease, COVID-19, and why it's particularly dangerous for the senior population. So when COVID first came about, the scientists and doctors were under the mistaken impression that it was only a respiratory illness. They thought people would get a cold, maybe a flu. Some people were dying of pneumonia or what they thought was only pneumonia. And so they labeled it as a respiratory illness, and they lost valuable time in that. Later, after a few more complicated deaths, they realized that COVID-19 actually affects the blood vessels. What it does is it constricts the blood vessels in your body, which then leads to a host of other complications like heart attacks and stroke and liver illness and lung fibrosis and issues like that. If you're already affected by one of those issues, then it just sort of exacerbates it. It makes it much worse. And that's why the senior population was much more at risk. So to show you how much of a risk was with the senior population, I'm going to share this slide with you. This is the number of deaths in the country up until today. Well, it was updated on Jan 21. So the number of deaths was about 350,000, and they've divided it by age group. And you can see that, you know, up until about 50 some years, it's about 16,000 is the highest. Then it starts to exponentially increase, the highest being in the 85 and above population, which amounts to almost 1/3 of the deaths. So, so this is why you can see why it is particularly dangerous in this senior population. 65 is about 75,000. This is about 95,000, and that was about 110,000. So just this 65 to 85 age, 85 and over, amounted to almost probably 2/3 of the deaths. So, so it's that deadly among that population. So needless to say, something needs to be done with it. So in comes the vaccine. And obviously, when you have a vaccine out, you want to be as quick as possible to receive it. However, this vaccine came with its own set of questions associated with it. So I'm hoping I can address some of those today. So in short, I'd like to say that the COVID-19 vaccine is a must to take, especially for the seniors. And I'll go ahead and explain the rest of my talk as to why I think it is so important for everyone to get this vaccine. So let's talk about, in general, in very simple terms, how vaccines work. Okay, so let's say the smallpox or the polio vaccine or any of those in the past that we've had all this time, the MMR and BCG and whatever else. These vaccines work by introducing either a part of the live virus or a dead virus inside your body. So they actually take a polio virus and they introduce it inside your body, and a very, very small part of it. And when that happens, your body creates these antibodies, and it creates these T cells and lymphocytes and everything to fight that particular disease. And of course, it goes in and fights it and defeats that because it's a very small quantity of it. Then let's say a year down the road or 2 years down the road, if you were to actually get the disease, let's say now you are introduced to a much higher dose of this polio virus, your body remembers it. Your body will go ahead and say, oh, this virus, I remember we have kept these lymphocytes hidden somewhere in our cells. Let's activate those. So those antibodies get activated, they start coming up in large numbers, and they go and basically defeat that virus. So in general, that's how vaccines generally work. So, so basically, you do get a part of the disease inside you, and then your body goes in and fights it. However, the current COVID vaccines in the US work very differently. So the way they work is that you introduce a part of the protein inside you. So let's say this is a part of the protein cell. It's an RNA. It's it's part of the genetic sequence of this virus. And then the virus is mostly made of a protein substance. What the scientists did is they just took a part of the protein substance. They didn't take the virus. They didn't need to take the entire protein. They just took a very small a part of this protein, and that's called the messenger RNA. It's called the mRNA. And they took that and they wanted to inject that into us. Now, if you just take the protein and inject it, your body's not going to recognize it as anything. So they need to put it into like a fat cell or something. They need to make a cell out of it. So that's what they did. They put this protein inside some fat cell, and then they inject that into our body. So now the body recognizes it as a foreign substance. The body recognizes it as a cell that it needs to destroy. So it comes up with all the antibodies needed to fight that particular protein. And your body automatically generates the antibodies. So the brilliant thing about this particular vaccine, as compared to the previous ones, is that it does not introduce the disease. They don't need to give you the COVID virus. They are just giving you a part of the protein which does not cause the disease. So this is one of the safest vaccines you can ever take. Up until now, because we just didn't know enough, we weren't reading up so much on the vaccines we've taken, but all those vaccines, we were actually introducing the disease inside us. This vaccine, and which is why people said, oh my God, I don't want COVID, I don't want to take this vaccine. Well, you're not getting the COVID, you're just getting a part of the protein, and your antibodies are reacting to that. So both Moderna and Pfizer work with this technology. And this is a breakthrough in science, because now they are planning to, they're also working on an HIV vaccine around the same theme, because again, nobody wants to be injected with HIV. So, this new messenger RNA technique is just brilliant for a lot of these vaccines to come about. So in short, it's one of the safest vaccines you can take. Not only that, there's something called the efficacy of a vaccine. It's not how effective it is. There's a different way of measuring it, but it's for the most part, how many cells would your body create when you get this vaccine? And in typical vaccines in the past, it's about 50%, 60%. These two vaccines have made it 95% effective or efficacious. So they are that good. These vaccines are like just excellent vaccines. So, needless to say, they are extremely safe and very efficacious. So, so now let's discuss some of the questions that people have uppermost in their mind, which, and rightly so. So the first question is, why was it developed so fast? I mean, it was only developed in a year, when ordinarily vaccines take 10, 20, 40 years sometimes to make. So what happened here? Did they cut corners? Did they, is it going to be safe? The answer is yes, absolutely. It's extremely safe. And the reason it was developed so fast is COVID is part of what's called the coronavirus family. Corona comes from the crown, which, if you've seen pictures of the COVID vaccine, it has these little spikes around it. It's not the only virus that we've seen around this coronavirus family. So in the past, there were two epidemics called the SARS and the MERS, which were sometime in 2010, 2012, where they were also from the coronavirus family. And since then, scientists have been working on these on vaccines for those two illnesses, for the coronavirus family, basically. So the research had already been done around how to go about attacking these coronaviruses. What wasn't done is the particular COVID vaccine, which took about a couple of months for them to understand that, okay, for COVID, we need to do this. And that's what they did. And I think they injected their first test subjects sometime around Jan or Feb of last year. So it's been a year since the first person got the vaccine. Safety-wise, vaccines, about 98 to 99% of the bad effects, if there were any, have to happen usually happen in the first 2 months. So among all these vaccines that have been generated all these years, they found that the bad effects usually happen within the first 2 months. They've given it a year. So they know that whatever ill effects were there were easily handled, and none of the 40,000 subjects each that were given the vaccine encountered any sort of a bad effect after 2 months or whatever the time they'd given was. It's been a year and none of them have had any issues. So again, safety-wise, they've done the due diligence. They have, it's not 1 year in the making, it's been 10 years in the making. So, so that's another important thing to remember, because research had already been done around it. If they were starting from scratch, that might have been an issue. The other thing we have to remember is that this is a pandemic. The entire world is involved. In MERS and SARS, there were only certain areas of the world involved. So not everybody sort of put their resources behind creating a vaccine. It's very different now with COVID. Because COVID has affected the entire world, every country is working on developing these vaccines. So the scientists, they put their best scientists on the job, they poured in millions of dollars into it. So obviously that would also expedite the way these vaccines are made, because you know, you're not doing what you typically do, which is only give little resources to the problem. Here, everybody is working on this problem and the solution. So that was another reason it was so fast at manufacturing these vaccines. Another question is, if I take the vaccine, will I get COVID-19? And again, the answer is no, because it's again not a live virus, like I explained. You are not getting the disease. Nobody's injecting the disease into you. So you are not going to get sick with COVID at all. Why do we need 2 doses? So there are, and it's not the first vaccine that needs 2 doses. There are several. Shingles, I believe MMR needs 2. There are quite a few vaccines that need 2 doses. The first dose is when they've realized that your immune system sort of gets into high gear and starts to prepare an immune response. However, the number of antibodies generated are not sufficient to fight the virus. So they went in and said, okay, a few weeks later, they injected a second booster dose, as they call it. And sure enough, after that, there were all these antibodies created, which were sufficient to fight the COVID-19. So far they found that these 2 shots are sufficient to fight this virus, and hence the 2 shots. So if you're going to get the Pfizer vaccine, it takes, it's 3 weeks apart. Your second dose will be after 3 weeks. If you get the Moderna, the second dose is after 4 weeks. So usually when you go in for your first dose, they'll schedule you right away for the second one. And this is again another valid question. If I recently had the disease, COVID-19, should I still go ahead and get the vaccine? And the answer is yes, with some stipulations. So yes, because again, like we've seen, this population, the senior population in particular, is seriously affected by this disease. So you want to go in and get vaccinated as soon as possible. However, you do want to let your doctor know. So if needed, they might recommend an antibody test. They might want to go in and see whether you still have some antibodies that might have generated because you got COVID-19. If you do, then they might say, okay, let's do it after a month. But that being said, if you had COVID-19 recently, that does not mean you don't need the vaccine at all. You still need the vaccine because the antibodies generated from just getting the disease are not sufficient. They immediately dwindle. They have found people getting reinfected, etc. So it's just not sufficient to fight the disease again. So whether you got COVID-19 or not, you still need the vaccine, okay? Because that natural immunity is not lasting too long. Can pregnant women get the vaccine? Yes, they can, and in fact they should, because again, pregnant women are also very susceptible to this virus, and it's not it's not very safe for them either. However, of course, they should do it with their obstetricians, okay. So, but it's absolutely safe for a pregnant woman to take it. How about after the vaccine, can I just behave like normal and stop wearing masks? So that answer is absolutely not. You still have to follow mask wearing and social distancing. And the reason is, once you get the vaccine, you yourself will not get the disease. You will not get COVID-19. However, you can still be a carrier. What that means is that it can, let's say you are exposed to someone who has the disease. The virus can live in your nostrils, it can live in your mouth, it can live in your respiratory cavity. And every time you talk or you cough or you were to sneeze in front of someone, you would pass it on to those people who are not vaccinated, and they will get the disease. So your grandchildren, your children who are not yet vaccinated will get the disease, and you would be the carrier for them. So all this time, they were being careful around you. Now you need to be careful around them, because you'd still be a carrier. So let's say you can, of course, go about and go for a walk. You're no longer kind of stuck at home. But at the same time, mask wearing and social distancing needs to be followed. That does not go away until herd immunity kicks in. And what that is that once about 60% of the population gets vaccinated, the virus now doesn't have too many hosts to latch onto. So the virus slowly starts to die away. And every year you'll hear of some cases coming up every now and then, but it cannot be in pandemic proportion anymore. So, so until then, we will probably need to wear the mask. So masks are here to stay for quite a while. So get used to it, wear the mask above your nose, and protect everyone around you. How will I feel after the vaccine? Your first dose, it's basically really nothing much. You might have some soreness around the arm, just like any other shot that you get, because it's intramuscular, so your muscle might be a little sore. Some people have experienced flu-like symptoms. The flu-like symptoms, again, does not mean it's COVID. The flu-like symptoms are because your immunity is sort of getting into this high gear. So your body is really excitable. It's just reacting to this foreign body that's come in. And the flu-like symptoms, the achiness, the fever, if any, is as a result of that. It's not that you have COVID. So do not panic. It's an absolutely normal reaction after getting the vaccine. And it seems after the second dose, it's even more so. So after the second dose, they have known people to have a fever for a day or two, achiness, they might have to lie down for the day, and that's okay. That's your body reacting to the vaccine. It is not COVID. Are the intensity of the symptoms after the vaccine related to immunity from COVID? What I mean is, if I don't get anything, if I don't have any pain, if I don't get flu-like symptoms, does it mean my immunity is not working? No, it does not mean that. Your immunity will work. You will be vaccinated against COVID, no matter how your body shows that reaction, whether it will be in terms of a fever, or it might not be anything. And that's okay too. Even if you don't feel anything, doesn't mean it's not acting. It is acting. It will act on everybody. So, so rest assured, you will be vaccinated against COVID once you get the 2 doses. How soon after my second dose can I travel? So firstly, you cannot travel with just the first dose. You're not vaccinated with just the first dose. The entire vaccine is 2 doses. So make sure you take the entire dose. The immunity starts to kick in about 2 to 3 weeks after the second dose. That's when your antibodies and all that sort of are generated. It takes about that long for the body to generate these antibodies. So you cannot travel until then. So I would say about 3 to 4 weeks after is a good time to travel if you choose to go to India or wherever else. However, please remember mask and social distancing. And if you were to travel, wherever you decide to travel, you need to quarantine, because remember, you might still be a carrier. Let's say you go by flight and someone there had it, and you're not going to get COVID, but you might be a carrier for whoever you're visiting in India or wherever else. So once you reach wherever you want to go, make sure you quarantine there for 2 weeks, which means you don't see anyone for 2 weeks. And after that, you're safe to do whatever it is. You can socialize and such, again, with masks and social distancing. Does the vaccine protect against these new UK strains and these other mutations that have come about? Short answer is yes for now. Long answer is they don't know for sure. I'll explain. So what they have found is that the UK strain and this other new strain that they found in the Bay Area, in California for now, is highly transmissible. It just means that that the virus can reproduce very, very quickly. However, it's not stronger, as in the virus is still more or less the same. It hasn't gotten stronger. It hasn't developed any new protein or anything which the vaccine can't fight. So for now, both Moderna and Pfizer tests have shown that the vaccine is effective against these new mutations. The one exception was the virus in, I believe there's a new mutation somewhere in Africa, I forget where, and it's not as effective. It is still effective against that strain, but not as effective. So all the more important for all of us to get vaccinated as soon as possible, so that this virus doesn't get much of a chance to mutate. Otherwise, once it goes out of control, it's just going to be harder to form these vaccines. And if they do realize that it's mutating and this particular dose you've taken may not be sufficient to fight that, then it'll be like a booster dose, like we do for flu vaccine. For flu vaccine, if you remember, every year you go in to get your booster dose. And that is to fight all these new strains that come about, because flu is constantly, mutating. So it's the same with this. If they feel like this virus needs a booster dose, they'll let us know. For now, they don't think a booster dose is needed. But again, not enough time has passed for them to know that for sure. So it's only been a year, so they'll be going back, checking the antibodies of these people whom they had given the first vaccines to, and then they'll see whether booster doses are needed or not. But for at least a year, you don't need it for now. Where can I get the vaccines? I will send this information via email so it can be forwarded to you. So right now, if you're part of PAMF and Kaiser, they themselves are giving it out to their patients 65 and over. Stanford has started giving this out. El Camino Hospital is giving it out. And the county is giving these out. So, so there are multiple places where you can go get this vaccine. Make your appointment, carry your ID so they know your age, and get the vaccine as soon as possible. And that's it. If anyone has any questions, please let me know. I'll take questions if.
Can I have one question?
Sure.
I want to know. Hello.
Chabra sahab puchna chahte as well. He wants to ask a question, Mr. Chabra. Oh no, Mr. Dave.
Yeah, thank you. Dr. Saab, I had just want to know if you take these 2 doses now, then are these doses to be every year repeated as in the other vaccine cases?
We don't know that. That's what I was saying. We don't know that yet. As of now, no. As of now, this vaccine is sufficient to fight the COVID, and the antibodies are sufficient a year later. However, now it will depend on how fast this virus mutates as compared to, how fast we are all getting herd immunity. So now it's just a matter of time, which is why it's extremely important for everybody to go get vaccinated so that we can stop this virus in its tracks.
Okay.
But as of now, no, it's the booster dose is not needed for now, but we'll only know more later.
Okay, thank you.
Great knowledge.
Davis up, unmute yourself.
Okay. Yeah. So my mom has a history of cancer almost 4 years ago. Is she okay to get vaccine, or we have to
Yes.
consider it?
Yes, absolutely. In fact, she is one of the population that should absolutely go and get the vaccine. So there are no contraindications to either the Pfizer or the Moderna, except if you've had an allergy to vaccines in the past. So if for whatever reason you're taken a vaccination and you got hives in your body, an allergic reaction is not just minor stuff at the injection site. An allergic reaction is where you actually broke out into hives, your breathing stopped, etc. If you had any of that, you have to let your provider know. That doesn't mean, it still doesn't mean you won't get the vaccine. It just means that they might give you something before giving you the vaccine. So there are absolutely no contraindications to this vaccine as of now. In fact, they are saying that people with these illnesses like cancer, high blood pressure, heart attacks, strokes should be the first ones in line to get this vaccine.
Okay.
So
Then
should we take the permission from our provider, doctor?
yeah. But
If you are part of PAMF or any of these others, they will send you, I think they send you an email to sign up, or they'll call you or something like that. So you can just sign up for that. You don't need permission. I mean, you can let them know. I mean, they know your history. It's in front of them. But it's always a good idea to let them know. Also, if you're allergic to things, some people are allergic to different things. It's just a good idea to let them know. Like I said, there are no contraindications to this, but it's always a good idea for them to be prepared. And what they're doing right now is after you get the vaccine, they're keeping you there for about 10-15 minutes to see that you're not getting an allergic reaction. So they're doing it in a safe environment.
Ratna Murthy ji, next.
Yeah, I have a question, doctor. I have taken my first dose, and then how safe I am till I get the second dose, booster
You're
dose?
not safe at all.
I'm not safe.
No. So basically, you're not immune yet. So
Okay.
you still stay at home. You still manage the masks. You still do the social distancing until about 3 weeks after your second dose. You're only immune after that.
Sushma Agarwal ji.
Thank
next.
you.
Sushma ji.
That's how.
Yes,
Just
hello.
please, I have taken a shot of flu and single a week ago. And when should I go for this COVID? I got the time. Next dose.
I'm sorry, I didn't understand your question. Can you please repeat?
I have taken flu and single shot.
Okay.
Flu and shingle. Yeah.
2 weeks after. 2 weeks.
Two-
You have to wait 2 weeks.
2 weeks only.
Yes.
Okay. Thank you.
Yes.
Veena Jain ji.
I have the similar question. I took my shingle shot, first one, and the second dose will be sometime first or second week of February. And if I get the call for COVID the same time, can I take it within few days apart or something? Or I have to wait?
In which case, so shingles vaccine is valid for 6 months. My recommendation would be get the COVID. So get both your COVID doses, wait 3 weeks, and then get your shingles second dose. But again, check with your doctor. But that would be the right way of doing things as opposed to postponing the COVID vaccine. Because now it's more important that you get the COVID vaccine first and then get your shingles.
And I have another question. If I go to India, So I should stay away 10 days. And when I come back, also I have to stay away.
It depends on whom you're meeting here. Yeah. So
Myself.
like everything, yeah. If you're here and you're living alone and you're not going to be in touch with anyone, then that's an automatic quarantine. But yes, every time you travel, you will have to quarantine for 10 to 14 days.
Thank you so
Yes.
much.
Yeah.
Wonderful
And it's not for
session.
yourself. You will be fine. It's to protect others.
Now,
Yes, thank you.
India vaccine is only 50% efficacy.
Yeah, so the India vaccine, they're both very different. They're not the mRNA vaccines. The AstraZeneca is it's a rhinovirus. It's a cold virus from the chimpanzee. So they found that these chimpanzees were getting a cold, so they actually took that virus and they injected it, and the reaction is the same as a COVID. It's creating the same antibodies. So that's what they are injecting, and I think the Indian one is a dead virus. I believe they're injecting a dead COVID virus or something to that effect. I haven't read too much in detail, but it's not the mRNA technique.
And it still develops same kind of antibodies, even though it's dead virus?
I don't know. I haven't read up on it. I know you're right that the efficacy was about 60-70% as opposed to 95%.
But the world seems to be buying it.
The amount of antibodies.
Yeah, the world seems to be buying it. Everybody's happy. Brazil is happy to have it.
Yeah, I mean, if you come to think of it, most vaccines we've taken, the maximum of efficacy is 50%. So this is 70%, which is still better. So it's just that, yes, and the problem with Moderna and Pfizer is that they're too expensive. The rest of the world cannot afford it. Plus, they need to be refrigerated. Again, it's very impractical. So
It's
Yeah, I have read somewhere that if somebody one should not take vaccine if he is taking aspirin or the blood thinner. Is it true?
That was true for the India vaccine, not for us. You should let your doctor know, though, that you're taking these medications. It's not a contraindication. You might just see a little bit of bruising, a little more than normal around your arm and such. But again, it's not a contraindication, but you should let them know.
Okay.
what percent of vaccinations have to be reached before all the schools and shops and everything will get opened? What's your read on that?
Well, given all these anti-vaxxers out there, I wonder when that'll happen. But we're hoping at least, I think they said herd immunity, that they would say 60% might be safe. So once about 60% of the population gets vaccinated, I'm very optimistic about the Bay Area. I mean, we do believe in
Biden's plan of 100 million vaccination. Will that reach 60% level, even because the younger people don't need it as much? So
right. Well, so firstly, none of these are yet applicable for 16 and under. So that population is still going to take some time for that vaccine to be developed. And I believe that's sometime in the summer. So that will still take some time. But I would say time-wise, I'm hoping if it doesn't mutate too much, that by the end of this year, we should be much safer than we are currently.
Pushpanjali wants to ask one question. Pushpanjali ji.
नमस्कार डॉक्टर जी.
Hello,
डॉक्टर नेपा जी. हाँ, मेरा क्वेश्चन ये है, my brother took Mandraid vaccine and I took Pfizer vaccine. Is there any difference between these dosages?
No, not at all. It's just 6 of one, half a dozen of the other.
Okay, thank you.
Nothing. It's just that if you take Pfizer, it's 3 weeks apart. Moderna is 4 weeks apart. That's all. And it's I think there are more of Moderna because again, it's a little more practical. The other one is at -60. You have to store it, which is very hard. The Pfizer one. So Moderna is about -20 degrees, the storage. So it's a little easier to store it. So that's why we have more of the Moderna. And I think it's locally made. So
thank you. Great service. Thank you very much. God bless you.
Any other questions?
So I had a question. When you take, they're giving all these medicines, the vaccines free, why is shingles being, they say it's very expensive medicine, vaccine?
I think basically, I mean, this is not a cheap vaccine either. Moderna.
Yeah, but then they are giving it free. They're giving it free.
Because it's a pandemic. So you want people to vaccinate. You don't want money to be an issue when there is a pandemic. So that's why the government is basically covering the cost. But shingles is not a pandemic, so obviously that they're willing to sacrifice the few people. I mean, you don't die of shingles; it's just extremely painful. So then you have to pay for it, just like any other.
All right. Well, I mean, we don't pay for any other vaccines,
Yeah.
Yes.
Yeah, I don't know. I think it also might depend on insurances and such.
Okay. All right.
Yeah.
Kaiser gives it free.
Kaiser gives it free. Okay. Yeah. Some just
Yeah.
don't. I know.
I also get it free. I also get it free.
Yeah. So some people get it free. I think it depends on the insurances.
Insurance. Okay. Thank you.
But don't create a shingles pandemic, though. Just for save it. Just.
I don't want any pandemic.
No.
We are vaccinated. We won't spread.
Doctor, I have a question.
Yes.
After the second dose, as you say that there could be reactions like flu-like symptoms, body ache or feverish feeling or joint ache. Is it advisable to take those pain suppressing and fever suppressing medicines when you have these symptoms after the second dose?
Yes, absolutely. So do whatever you need to feel comfortable, because again, you're not getting COVID. You are, it's just your body reacting to, it's your body getting immunity. So, if you have to take Tylenol to feel better from the fever, that's totally fine. It's not going to interrupt the immunity process at all.
Not going to interfere with the vaccine effect.
Not at all.
No harm in taking.
Yeah, no harm at all.
Thank you.
Any more questions? Well,
Dr. Singh has already covered all the questions which are expected to be asked by everybody. So, you please ask the questions for the sake of asking the questions. No.
I think the doctor has been very clear in telling us everything, every details was really good.
You should ask.
Very informative. Thank you.
Thank you.
So,
that's a question.
Nipaji, I can ask you a question.
Yes, please.
Dr. Nipa, I'm going to ask you a question. After this vaccine, once we have taken both the doses, then if we go out for a walk, it's okay for us not to wear mask then?
No, it's not okay.
You said very clear.
Absolutely not.
Even though nobody around us, still we should wear mask.
It's always a good idea because it's an airborne disease. You don't know, you might encounter someone. So keep your mask. Of course, if you're the only one walking on your street, then you don't need a mask. Or if you're following social distancing outdoors, 6 feet and more, you may not need a mask. But in times like this, it's just always good to err on the side of being cautious till we are, we want to end this as soon as possible. So it's just better to keep a mask handy.
When this thing started, actually, we were bringing all the vegetables and bottles, everything. We were washing it, cleaning it, which I have stopped doing it. Is it okay?
Yes, because they've realized it doesn't stay on surfaces for too long.
Yeah.
So it's pointless. It dies pretty quickly on any surfaces. So where it lives is in the respiratory tract. So, and in the air. So that's why you want to sort of be cautious about that.
Okay, I have one small question.
Sure.
Because, like previously, whenever I used to go for a walk or something like that, and then when I'm getting tired, So my daughter used to tell me that don't sit on any benches, this, then you will get the virus and all. So now you are saying it's not staying on surfaces. Is it safe to sit alone?
Yes. So if you're outdoors and you're following social distancing and all that, the virus can come on a surface, but it dies very quickly.
Okay.
So yeah, unless you sat right after somebody who had the virus, who touched their nose and then touched the bench, the chances of all these things coming together, this perfect storm, is very low. So so that's why it's just, now if you're going to a grocery store, that's a different point, because now there are a lot more people there touching different things. So there you want to be cautious. There you want to wear gloves if you can.
So any bench, like wooden bench or cement bench, anything is okay right now?
Yeah, and I mean, as long as it's not heavily populated.
Yeah.
Yeah, I have a question.
Yes.
Because I have been hearing news at many places, and many of them are highlighting the reactions of these two medicines. So I don't know, from your talk I heard at 3 places, it doesn't seem like that there are lots of reactions to people.
Yes, so both Moderna and Pfizer, the first dose is almost no reaction. And the second dose, you might have some fever, achiness, but it goes away within a day or two.
No, they are not talking about these two. They are talking about serious reactions.
There are no serious reactions that they've found so far. There was a case in, I'll change that. There was a case somewhere in Southern California where they found, I think, 10 people who had the vaccine in one particular facility had an allergic reaction. By allergic reaction, I mean hives and such. So they recalled.
Yeah, but they again found that there is nothing wrong in that.
And they found that it wasn't the vaccine, it was where it was being administered that was the issue. Or these people had something underlying. So
other than that,
there was someone in Florida where they found 2 weeks after, and I haven't read this one, but someone mentioned that they found.
I heard it at Cupertino. I think somebody is in.
Yeah, so now you're talking about 0.00001% of the population getting something, which we don't even know is related to that was a Pfizer vaccine, and Pfizer is looking into it. So you don't even know, but when 99.99999% of the people are okay, the vaccine is safe. You're not.
I think they are just saying it because they want to promote their own vaccine, so they may be.
Yeah, either that or also, I think people forget that getting the disease is far more deadly, and more people will get it than dying from